Hi, I'm Dr. Matt Chenault, and let me share with you the most common causes and the most effective therapies to help with carpal tunnel syndrome. Now, it all starts with two different ways, guys. Number one is the major traumas, and that usually is an automobile accident. So when you get in an accident, the first thing you do is you put your hands out, hit the dashboard. That is the major way you get carpal tunnel. The second way is keyboards. It is computers. It's the repetitive motion of the keyboards and the computers. Now, the most common symptoms that we see with carpal tunnel is that it could be a sharp pain. It could be a dull, achy, just throbbing pain in your hands. You can get like pins and needles. You can get weakness in the hand where you're dropping coffee cups, all right? Those are the most common symptoms we see with carpal tunnel. Now, the most effective therapies for carpal tunnel syndrome is what? In my experience is number one is chiropractic, number two, clinical massage, and number three is rehab. Now, what chiropractic is, guys, is it is a form of physical medicine where we come and help identify the area. We help mobilize that area. Now, we help that three different ways. Number one is with the pinched nerve. Number two is with the joint irritation. And number three is with any type of disc bulging. Now, what clinical massage is and how that's going to help is we're going to go into that area that with all the muscle tension, okay? The trigger points, maybe even a little bit of a spasm in that area, and the massage therapists are going to help stretch that area and massage that area out, all right? Now in our rehab department, what we're going to do is we're going to strengthen certain areas and we're going to stretch certain areas because it's very important, guys, with carpal tunnel syndrome, we don't have a permanent injury, and that's the reason why we do our therapy. Now in summary, okay, how we help with carpal tunnels in three different ways. Number one is decreasing your pain, and then a lot of times it's within the first visit we're already seeing a decrease in pain. Number two, helping decrease your muscle pain, and number three, help increasing the range of motion of that area now, okay? You're able to move that area and you're not dropping things. Now, what my patients have told me in my 14 years of experience and how we help with carpal tunnel syndrome is number one is work, because guess what? Okay, if you have carpal tunnel syndrome, a lot of times, especially if you're the computer, you're not working now, okay? If you're working at any type of factory, if you have weakness in your hands, you're not working, or you're not working 8 hours. There's just no way with carpal tunnel syndrome. Is sleep. A lot of times with sleep, people wake up with a dull, achy, throbbing pain into their hands, very intense. You can't sleep that way. And number three is daily activities. Well, guess what? That's putting your shirt on. That's just doing what? Putting the groceries away. Anything involved with your hands, okay? Tying your shoes, putting your pants on, all right? Now, hey, we can help with carpal tunnel syndrome. Give us a call, 664-4600.